Welcome to Covered Season 2. Get ready for an amazing set of interviews with business strategists, insurance experts, and wellness professionals in Montana, Idaho, and Wyoming. The focus this season is to help growing companies build a healthy and safe work environment. We'll cover pressing questions like what exactly does it cost for a new business to provide health insurance to a team? And if you're a benefits consultant, why is Mountain Health Co-op a first choice for so many businesses in the Rocky Mountain West? If you're ready to take ownership of your business and your benefits knowledge, this is the season for you.
We are here live at Mountain Health Co-op HQ with Richard Miltenberger. Richard, welcome back to Cover the Podcast. We're really psyched to have you back on.
Thanks for having me, Kyle.
Yes, and today we are talking about COVID-19 and health insurance and the health co-op and how everything has been going. So I just want to start by asking, how are you doing? How is your family? How has all this been going for you?
You know, I'm a bit of an introvert at times, Kyle, so this has been kind of made to order for me. Sheltering at home is like, a briar patch I like to be thrown into.
Haven't minded it.
Yeah, haven't minded it a bit. We actually live out in the country, so taking a lot of walks, hikes, and things have lifted up a bit here in Montana with the governor's orders, so you can get out more. But frankly, we've tried to still keep some social distancing going on, and we've not been very active in the social scene, even as the requirements have allowed us to be.
Sure, and I should mention that we're recording this mid-May, so to put things into perspective, we've been quarantined for quite a while, so if we sound a bit jovial, I guess, it's not because we're celebrating a global pandemic, but just because we're sort of used to being quarantined. We're sitting our safe distance apart here. Similarly, it seems like with quarantine, deep work has become easier, like cutting distractions out, focusing on one project.
Yes.
It seems like when you're working from home, that's been something I think a lot of people are discovering, that becomes a little easier.
Yeah, it actually is surprising how productive you can be when you don't have somebody to chat with over the coffee machine.
Yeah, pros and cons. The serendipitous conversations are no longer, but certainly the deep work.
Yeah, I'm ready to get back though. Honestly, yeah. I miss people.
Yep, I think you and a lot of other people share that thought. So let's talk about the co-op and how if we can rewind a bit to February and March, and what was it like here when sort of things started to shut down and people really started to look closely at their health insurance and think to themselves, okay, I need to really consider if this is a possibility for me to contract COVID-19. What happens? And what was going on here? What did that look like?
We had some incredibly long days because we were trying to keep up with a regulatory environment. So as a health insurance company, we work with the insurance department as well as with the federal government. And then there's kind of a third element that came into play, and that is the public health departments of each of the states that we operate in, the governor's offices in those states, as they were coordinating efforts to make sure that the health insurance industry played its part, to respond to the pandemic. So there was just a lot going on. I mean, some 12-hour days, 14-hour days, in those first, I'd say the second and third weeks of March, as we'd kind of been reading about this at a distance in Italy and Spain and the UK and the New York City, and then it just kind of almost in slow motion, we saw the preparations happening here, and it was there were some very busy days, and I must say it was encouraging to see people working together. Different insurance companies, different regulatory authorities for a common purpose. Mm-hmm. So in some ways it was encouraging, but boy, some long days.
Yeah, and I would imagine some concerned members also. And I'm wondering if you, during that time, heard from any members that were concerned, or sort of what the communication to members was like during that time.
Well, it was communication both ways. We heard from our members, wanting to make sure that there would be appropriate coverage for both the testing and the treatment of this new pandemic and how that would look, and then we, as those policies were formulated, coordinating an effort back to the members, we really wanted to be careful, Kyle, that we not over communicate. I found, sometimes if you just look at your own email inbox, you can learn what not to do. So I was getting regular communications from credit card companies, from the company that I bought my car from, about how much they cared about me and what they were doing to address this issue.
It felt like a checkbox that needed. Every company said, "Okay, I need to send this COVID-19 email."
Exactly, and so we looked at it and said, "Well, you know what? People they should not be getting health information from their insurance company, but if they do come to our website or come to us, we want to direct them to an authoritative source." So what we managed to do very early on is make sure that our websites had links built, active links, so that people could, when they're asking questions about COVID-19, it would redirect them to their state health department. And that way, as communications would change, because their recommendations would change almost daily, they were getting health information from the appropriate source. And then beyond that, we had a significant effort to make sure that we did cover and that the terms of coverage were clear for kind of an evolving situation, and that those messages people needed to hear and wanted to hear. In other words, kind of insurance questions, because that's what they come to us for. So we made sure we had our message developed and that it was appropriate and then got that out there.
Let's talk about the insurance piece, because for a lot of people in those early weeks and months and even today feel like they need some sort of strong foundation to just stand on and feel grounded. Yeah, I heard something say, try not to use the word uncertainty as much, because everyone has been saying that, but there was a lot of uncertainty and there still is. And so for co-op and for members of the co-op, how did your team help provide some just, hey, health insurance during this time, not something you need to be worried about. We've got you covered. Can you talk about some of the things that quickly spun into action during this time and some of the benefits?
Yeah. Well, one of the first things we were hearing from the medical community is they did not want people who thought they might have symptoms of COVID-19 to come into the medical offices. And then when someone did come in, they didn't want the office to be filled. So one of the early things we did was to inaugurate a really rapid telehealth effort. And that would mean that not just a special telehealth service there are some companies that are hardwired, and we use one called Doctors on Demand, that's all they do is telehealth. But we wanted people to be able to go to their primary care physician by telephone and make sure that the physicians were compensated for that, because otherwise the physician revenue source, their revenue stream would just dry up.
Right.
So we were able to get ourselves ready, frankly, before most physicians were ready to do that. Wow. The physicians have caught up, and they are effectively billing for telehealth. They were providing the service, they just didn't know how to bill for it.
Yeah.
And so we helped them and educated the physicians so that that would work well. But from a member standpoint, we wanted our members to be able to know that, hey, you can call the doctor and they will take the time. This is not a freebie. They will take the time to visit with you and help resolve your problem if possible over the phone, but if not, how to approach the physician office.
Yeah, that's such a win-win-win when you think about, the doctor can still see patients, the patient can safely communicate to their doctor without any contact, and the general population wins because people aren't traveling to a crowded waiting room.
Right.
So yeah, that's a great, it's just a great demonstration of how the co-op can move quickly. Can you talk about if you're a member and, you did, COVID-19 was real for you. It was something that you think you had symptoms and, you called telehealth and I said, yes, you need to get, and it turns out you test positive. What then if you're a member of the co-op?
We want to make, I think our role within the healthcare community is that we're a health co-op, but what does that mean? It means that we're a member-governed health insurance company. Mm-hmm. And so you have to kind of back away and say, okay, so what is the role of health insurance? To me, it's as much as possible, we need to stay invisible to our members, and it should be a fairly invisible process. The more that a member has to interact with their health insurance company, the more problems there are in the system. I think in other words, we ought to be the conduit for financial payment to the providers, and that should not require jumping through a lot of hoops where you're having to log onto our system to, it ought to be pretty seamless. And we've tried to establish that over time, and especially those processes bear fruit at a time like this where you have a crisis, where we can kind of be there for people so they know, yes, this is covered, and deductibles are waived, and coinsurance, all the copays, all that is waived for telehealth of any kind, whether it's COVID or not. And then if you go to the doctor's office or to the hospital, any treatment for COVID-19 would be covered without deductibles, copays. And there's this was a bit of you had to kind of get your head around this, because what if somebody has a disease like diabetes, and they always have healthcare costs?
Yeah.
How come the Johnny-come-latelys, the people that have never used health insurance, would now have their deductible waived, and they get everything at 100%, but I'm a diabetic and I never get anything covered at 100% until I reach an out-of-pocket maximum.
Right.
And the reason for that, I think people need to understand this, is in a pandemic, and this one so far has been not as bad outcome as could have been the case in most of the rural Northwest. So we've not had a New York City situation. But if you think about what happens if things get bad and the hospital's crowded, we don't want people who have to have a financial barrier from getting care, because we're trying to get people who have symptoms of the disease interacting with the healthcare system immediately.
Yeah.
And not saying, well, I owe the doctor for $500 from last year, so I'm embarrassed to go there. No, it's 100% covered. Just go. Take care of this. So it has to do with the nature of a pandemic and making sure people kind of come out of the woodwork, out of their homes when they have symptoms and identify themselves. Then the public health authorities can trace all of your contacts and family and do further testing. So that's kind of what's going on when you see these kind of unusual measures.
Yeah. No, thank you for clearing that up, because I think people do fear sometimes going to get medical attention, and knowing that their health insurance, wants to make that as seamless as possible. And I think I was seeing something that said if you do need a ventilator, covered.
Right.
And so, worrying about, this is going to be expensive, weighing the cost of insurance versus potentially your life. That's something that with the co-op is, we, again, have you covered. So you mentioned the team, working around the clock. What is it like today in May? People are, I think still, it looks like you're doing some different hours, but it's important to have some people here in the office. How's the team doing? Well,
healthcare in general is considered an essential industry, and health insurance is part of that, because we've got to keep the pipeline of money going to the providers during this time. And so we've always had our offices open. We have offices in more than one city, and we keep our offices open during normal business hours. The door's locked, but you can knock on the door or call, and someone will come and take. We have people that may want to pay their premium, and they're afraid that maybe it's in the grace period. They're afraid it'll be canceled. We keep the office open and somebody here, but we have had the majority of our staff, in fact, almost probably 80% of our staff has been working from home from the very beginning. We don't want to be part of the problem,
right?
But at the same time, we are required to, just like the people that work at the grocery stores, we have to get the job done.
Yep. Yeah, it's certainly essential. So thank you for your work. What questions about COVID-19 have I not asked that you're thinking, Kyle, we should really, think about addressing this, or the co-op's response to in this way?
Yeah, one of the things that with COVID-19 has kind of, I think, loomed over all all of this process from the beginning is making sure the healthcare system is not overloaded. Well, once you accomplish that, you've also kind of emptied the healthcare system.
Right.
And so there's been an effort behind the scenes to make sure that physicians and hospitals continue to receive some revenue flow because they've got to keep their staff on duty. And so that's been a struggle, and it's something the whole industry has worked together on, and our public health authorities have worked on. I've got to say, though, Kyle, I think there's a lot we can learn from this, right? I mean, some of the things we can learn is maybe take some time off and, play ball with your kids or grandkids. I mean, It's been kind of cool to see some of the family activities outdoors. I've noticed a big difference.
Yeah.
Not that we can all, take off the rest of our lives and retire at age 30 or something, but I think there's lots of things you can learn. And one of the things that I have learned being in the healthcare industry is that we have a very fragile healthcare financing system. So insurance companies are in the middle of the financing system, along with Medicare, Medicaid, other payers. And I believe what we ought to take away from this experience is that the current system is broken, and we need to fix it. And what do I mean it's broken? Well, here's how the current healthcare system works. If a provider, that is a doctor, a dentist, a hospital, performs a service, they get paid a fee. So they perform a service and they get paid a fee. It's called fee for service. If they don't perform a service, then they don't get paid. And that's not how, believe it or not, that's not how every healthcare system in the world works. And there are better ways of doing it. In fact, even back in the 1990s, when some of us were active in this world of healthcare, a lot of providers, a lot of physicians were paid on what's called a capitated model. Capitation means, the word cap means head. So it's per head. And capitation would mean if I'm a physician and I see 1,000 patients, I'm going to get paid a little bit of money every month for taking care of those 1,000 people. That way I get paid if they're well. So it's kind of, you're incentivized to keep your patients well.
Right.
And it also provides a continuous flow of funding, and it takes away any perverse incentives in the system. Again, in the system today, you've got to kind of almost sell something to get paid, and that's not a productive way to run a healthcare system, in my opinion. And other countries do it differently. I'm not talking about national health insurance or Medicare for all. We can have those debates. What I'm saying is we need to pay providers differently. And I hope that this COVID-19 crisis has proven that to everybody, and we can start that national dialogue.
Yeah, that's a really interesting model. And I hope that it does get examined, because it makes sense to me in that explanation. It's almost like a subscription. Like if you're a doctor, you have 1,000 subscribers, and they come to you, and like you said, you're incentivized to keep them healthy and keep them, hopefully, maybe they come back, but hopefully not, because you've done your job and they're doing their job.
Right.
Yeah.
Right.
Richard, last question surrounding COVID-19 is loss of coverage. And, with 30 million plus nationwide, filing for unemployment, that's a real concern for folks. Is I've lost my job, I am unemployed, and perhaps they've also lost insurance. What advice would you have for somebody in that situation?
Well, if you've lost insurance through your employer, there's several options available, and we'd certainly encourage everybody, especially at this time, don't go without health insurance, right? You want to keep your assets protected and keep your connectivity, your financial connectivity to the healthcare system alive. It's like almost like a deep sea diver. You have the tube bringing the air down from above, and it kind of provides oxygen to the system. It provides a financial tube, if you will, to the healthcare system. And so if someone were to lose their job and lose their health insurance, there's a couple of alternatives. One is something called COBRA. COBRA is an extension of your group insurance. The problem with that is you just lost your job, and now your employer is no longer paying 75% of the insurance cost. So now you've got this additional burden to pay for all of your cost, not just the portion that you had been paying. And so what we would recommend is that you look at all your options, one of which would be COBRA. But I think a better option for a lot of people is when you lose your job and your coverage is connected to your job, it's a great time to go to the marketplace, to go to healthcare.gov, or to go, for those folks where you have a state-based exchange, go to the state-based exchange. But you can then get coverage that potentially has a subsidy, so it's more affordable for you. So It's a great time to do that. Some people would be eligible for Medicaid during this period. Not a time to say, well, that's government insurance. No, you need to get covered where you can, and Medicaid's a good solution for a lot of people. So would encourage people to not go without coverage during this period.
Yeah, great. Richard, if people have questions, where can they turn?
Again, I'd say if your question is concerning your own health care, go first of all to your family physician, to your primary care. Yeah. Great time, by the way, to remind yourself you need to have a relationship with a doctor.
Right.
Otherwise, you don't have someone to call. But certainly your physician. Also to go to your state's health authority. Every governor has a COVID-19 task force that they've set up. They have a website through their state government, and so that's a good place to go get general information. And if you want information about health insurance, then they're certainly welcome to come to us. We'd love to visit with them. Health insurance agents are another good source. So if you have an insurance agency or agent, they can help navigate the system for you. Yep. And that way you can get multiple perspectives. And obviously we'd love to have people visit our website if they're interested in health insurance. We have a simple website. It's mhc.coop, C-O-O-P, not .com, but .coop, yeah.
Yep, and we'll make sure to include that in the show notes here for folks to find it. And we actually just talked with Jeff quite a bit about the agent side of things, so we'll link up to that episode also.
Good.
Richard, thank you so much for your time. This has been extremely informative. Really appreciate it, as always.
Kyle, thank you.